Calder, what are the common contributing factors to wrong procedure surgeries? Meaning, that a doctor performs a surgery on you, and it's the might be in the right place, but it's the wrong surgery or something like that. Do they differ from those that lead to those wrong site or wrong patient surgeries? Are they a little bit different than that?
Sure. So there's a lot of overlap, but there are some differences. I mean, you'll see a lot of the same issues. Hospitals have policies and procedures in place to ensure that you're doing the right procedure in the right place on the correct patient. And there's a lot of safeguards and checklists in place that the medical professionals need to go through before every surgery to ensure that these things don't happen. And for both and for all of a wrong patient, wrong site, wrong procedure, there are a lot of common things we see that could cause any one of those three, such as skipping some of these policies and procedures or rushing through them or relying on sloppy documentation or having poor communication between the members of the surgery team. But what can be unique to a wrong procedure is such as similarly named procedures and confusion between the team members as to what type of procedure we're actually doing here. It could even come before the procedure. You could have misinterpreted test results that the surgical team is then relying on, especially in today's medical settings and the way hospitals are. Often it's not the doctor who saw them in the office and performed the test. It's not the radiologist or the pathologist who looked at the test results. It's an entirely separate surgeon, an entirely separate surgical team that oftentimes has never met this patient before and is just relying on all that past documentation and communications. And not only could those documentation errors occur in the individual patient's medical records, it could also just occur on the scheduling. You could put the wrong procedure on the scheduling for the operating room that day. And it's those types of things that can happen before or during the procedure that can lead to a wrong procedure.